Dr. B here, Demystifying the DSM, and we are in the series on psychotic disorders. I don't want to lose some of my followers that, psychotic disorders are our least common diagnosed mental health concern. However, they are the most catastrophic and life-changing as far as function, and that really brings me to the diagnosis of schizophrenia. So when somebody is diagnosed with schizophrenia, they have had psychotic symptoms for longer than 6 months and pretty actively in a 30-day period without remission. And so the main criteria is that they must have at least 2 symptoms over that period of time. And one of those must be a positive symptom. So we separate psychotic symptoms into 2 categories: positive symptoms and negative symptoms. Positive symptoms, and this is politically incorrect, but this means you are positively psychotic, right? This is, delusions, hallucinations, disorganized speech. And then negative symptoms are things like grossly disorganized, or just negative symptoms of this, things that you might also see in depression, like not taking care of themselves, just not being able to function, those kinds of things, not taking a shower. You can see all of you can see negative symptoms in other disorders, but positive symptoms are just in psychotic disorders. So you have to have at least 2 psychotic symptoms over that period of time with a significant impairment in function. So some of those functional things are work, interpersonal relationships, self-care. So schizophrenia is not taken lightly. When someone is diagnosed with schizophrenia, it is, we are saying that this is a chronic lifetime condition that we really need you to be on medication. And this is so hard. In our culture, in our country, we are allowed to refuse medication. And when you have a delusion that you are not sick, that, and you truly believe the things that are going on in your head, you don't want to take a medication because especially if you have like these paranoid or persecutory delusions that are telling you that, someone's trying to hurt you with medication. So schizophrenia is also a very hard thing to treat. If you know someone with schizophrenia, medication compliance is the number one thing that the support person in their life can be doing. Like, stay on your meds, because the likelihood of having another major psychotic break if you come off the meds is very high. So how do we treat that here at Mentally Strong? Medication management. I mean, if it's truly schizophrenia, there is not wiggle room to say they don't need medication. A lot of times in depression, we can do, intensive counseling, and we can kind of learn to find that strength. But, say that it's easier if you take medication, right? With bipolar, it's kind of hit or miss depending on how severe. But with schizophrenia, here at Mentally Strong, we strongly encourage compliance with an antipsychotic medication. So antipsychotics are a big class. We actually use them in bipolar and sometimes as an adjunct in depression. But they are the very specific treatment for schizophrenia, and that's what we're going to recommend. We can attempt to use the Mentally Strong method. It'll depend on kind of where this person is in their schizophrenia. It will depend on how severe it is. Especially early on, first break schizophrenia, I recommend doing the complete Mentally Strong method. Schizophrenia does not have to be a progressive disorder. And this is where it's very important if you are the support person for someone with schizophrenia. It does not have to be a progressive disorder. but oftentimes it is because people come off of their medication, they have another psychotic break, and with each psychotic break, it becomes more difficult and more difficult to get them back to what we call their previous level of function, right? So if you're here, you have a psychotic break, we get you back to about here, right? Maybe not completely back to where you were, but almost. And then you think, oh, I don't need this medication. So you come off of it. And it could be a year later, or it could be immediately, but you have another psychotic break and your function is way down here. When we treat you, we can treat you again. We can, put it into what we call remission, but probably not completely back to that previous level of function. So over time, the more psychotic breaks that this person has, it looks like schizophrenia is a progressive disorder and they get worse and worse. But it doesn't have to be. So that, again, the biggest thing for someone who is a support person, for someone with schizophrenia, is medication compliance. And getting them to a practitioner, a specialist that knows how to treat specifically those psychotic symptoms. So it's not necessarily a counselor, it needs to be someone who can prescribe medication. So that's what we do here. We will initiate the full mentally strong method in the beginning when we're there. If we are looking at a chronic, severely mentally ill schizophrenic, the likelihood that they can do the mentally strong method is pretty low. This treatment for severe schizophrenia is just social skills training. And we can use some of the choice opportunities in the mentally strong method to kind of do that social skills training, but they probably will not be able to do the whole method. So that's how we treat it here. It is very hard to be that support person for schizophrenia. Just keep educating yourself and get them professional help.